G'day, I am Lindsay Jensen and I'm a nursing student. Today I'm going to be demonstrating how to use a incentive spirometer. I always forget what they're called. So the first thing you want to do is check the medical record, make sure there's nothing that's going to interfere with the patient's breathing. Then you want to do some hand washing, PPE if you needed. Come in, identify the patient, make sure you got the right one, and then get your equipment. This is the spirometer here. It does come off here, you just connect it up. It's not really that difficult. Alrighty, so then, there we go, it back on. You want to close the curtain, close the doors, pretty much want to do that with all your patients. Assist the patient into a seated position. Check whether they've had surgery recently, because if they do, you kind of want to, we're going to go over this later actually, is to kind of put like a pillow or a blanket on the incision part to hold everything in, okay? You don't want them to be hurting themselves. So the first thing you want to do is just explain it to them, which I'm going to kind of do at the same time as I do it for you, okay? So just explain how to use it for them. What they want to do is get them to breathe all the way out first, just normally, and then once they're out, to put the mouthpiece into their mouth and just start breathing out, breathing in, sorry. So they've already breathed out, they want to breathe in, get them to go slowly and as deep as they can. It'll lift up this little white thing. Once they've breathed in as much as they can, get them to hold their breath for 3 seconds. You should be able to get a decent reading off of that. And there's, what's not on that side, it's on the side that's facing me. You'll see these numbers, and then you can record what they get to, okay, on that. And a few things to note: if they start getting lightheaded, just you can stop and take a few more breaths and start again in like 20-30 seconds once they're ready for it. The other thing is that you want to get them to do this about 5 to 10 times over a 1 to 2 hour period, okay? A good idea is if they're watching TV, tell them to do it on the ad breaks. Gives them, so that way they'll remember to do it. And that is basically it. There's nothing much to it. You know, you can, if you're only doing it once or once they're done with it, you can wash the equipment with water and just shake it dry. That's it, and I'm going to teach you a few other things in a little bit. Thanks.